the debate over health care reform really heats up. Democrats want a major overhaul. Republicans, they're saying it's never going to work. The watchdog on Wall Street, Chris Markowski, is here this morning to weigh in. Good morning, Chris.
Good morning.
Okay, so why is this such a hot, debated topic?
Well, you could take this going all the way back when Hillary Clinton put her health care reform back up. This was, what, 1994, if I'm not mistaken.
It didn't go anywhere.
It didn't go, well, it didn't go anywhere. It was a step forward. We obviously need health care reform here. It's how we go about doing it. It is my contention, my belief, I don't think we should be going the route of the government providing health insurance for all of Americans. It doesn't work. You're taking a look at countries that are actually implementing this right now, whether it be Canada, Sweden, Great Britain. They're pulling back. They're saying that this is not working anymore. We're going to have to go back in the opposite direction.
Okay, so let's talk about the plan. What are some of the things that it would include?
Well, that's what they're really fighting about right now. It's the infighting within the Democratic Party right now, is they want to actually include mental health benefits, dental, and adding all these extras on, and that's the real debate.
Okay, and it also says that Americans carry health insurance and employers help pay for it, because there's a lot of employers that are dropping medical coverage, especially when one of their employees gets a disease that's very expensive to treat, correct?
Well, I'm not sure about that, because usually what happens is if you're within a group or something like that, it's usually covered all the way. The problem with it right now is the fact that businesses actually get a tax deduction. It's actually salary. It's part of your pay when you have health insurance at a company. Yet if you wanted to go out and purchase it on your own, you're not getting the tax deduction. So that's a problem.
Yeah. Okay, let's talk about the fact that 60% of personal bankruptcies here in this country have to do with medical bills.
Well, why is that? People are going to ask themselves, why are health care costs so high? I deal with a lot of physicians as my clients, and I know how much money that they make, and it's not as much as everybody actually thinks it is. The reality is we have free health insurance here in America. You show up at an emergency room at any time, you are going to get taken care of. It's everybody who pays is paying for the people who do not pay. There's only one cost in there. All the costs are factored in.
Okay, we have a lot more to talk about, and you'll be back in the program.
It's going to be a long, hot summer on Capitol Hill as the debate over health care reform really heats up. Democrats want a major overhaul. Republicans say it will never work. The watchdog on Wall Street, Chris Markowski, is here to weigh in. Good morning, Chris.
Good morning.
Alrighty, so we're talking about, there's a lot of statistics coming out, like, for instance, that 60% of U.S. households have bankruptcies related to health care costs. The prescription that's currently being debated on Capitol Hill and purported by a lot of Democrats say that all Americans should carry health care, mandated, and that a government-run health insurance option would compete with private plans.
Well, that's the debate right now. Republicans, both sides want to have health care reform. It's just a matter of how to go about doing it.
Right. And I often think, see, we have to stop here, because it's almost like if you don't think that government-run health care is the way to go, then you're in favor of the current, fact that it's so expensive, which of course is not true.
It's not true, but there are options for people out there, and that's what we're getting into a lot in the chat room in regards to high deductible health insurance, HSAs. There's many different ways you can go out there and make it. Savings accounts, you coupled with high deductible insurance. There's great ways to go about saving money on your health insurance costs. The reality is that we pay for services that we don't really need. If you go out and you buy a homeowner's policy on your house, you're not buying a homeowner's policy that covers when the light bulbs go out.
Right.
Or the same thing, you don't have a car insurance policy that pays for the oil changes on your car.
Right.
Yet we assume that we should be able to go to the doctor any single time we want to go and have a $10 copay. Just as much as if we're hungry, we'll have to go to Ruth's Chris Steakhouse and be fed. It's nuts.
Right. And in most cases, you buy insurance with the anticipation that most of the time you won't use it, except for in the healthcare industry, where you're going to use it all the time.
In case bad stuff happens. Not to mention the fact that, what the reality is health care here in America is free. It's free.
You go to an emergency room, you're going to get seen.
We have an enormous illegal immigration problem here in this country. There's no doubt about it. And we're a benevolent society. We're, a very, gratuitous type of people. We go out there to want to help people. The reality is, if you're sick and you go to the emergency room, you're getting taken care of. It's not free. They didn't get it for free. Those costs are just passed on to everybody else. This is just Econ 101.
And real quickly, only about 30 seconds left, but I know your brother was just diagnosed with cancer, and I've had a friend who had to come back from Great Britain because he wasn't getting care. The problem is that you're going to get ration care, and then you won't be able to get to be seen quickly like your brother did, and now he's on the road to recovery.
If my brother, we looked into this. If we were Canadian, my brother went to the doctor, he had swelling in his leg. For the test that he needed to find out that he had cancer, he's got lymphoma, he still wouldn't know. At this point,
still be waiting months
if he was under the Canadian healthcare system, you wouldn't know.
Looks like it's going to be a long, hot summer on Capitol Hill as the debate over health care reform heats up. Democrats want a major overhaul. Republicans say it's never going to work. Well, our watchdog on Wall Street, Chris Markowski, is weighing in this morning. Good morning, Chris.
Good morning.
Okay, so earlier we were talking about this, but you were also in the chat room all morning long. So what are viewers talking about?
It was basically a lot of interesting comments going back and forth in regards comparing the Canadian system, the English system. We got some emails in as well, and there's various different facts that we can throw out there, which system is best, which one's not going to work. But the reality is that we live in a country right now where we have a deficit, a budget deficit of $1.8 trillion. 10 years ago, our entire budget was $1.7 trillion. If we are going to take on national health care, where the government's going to be in charge of the entire thing, we have Medicare, Medicaid, which is underwater, Social Security, we have to make decisions here. We're going to have to pay much, much higher taxes across the board, and they're not going to be in income taxes. You're going to probably see $6 to $8 a gallon gasoline. You're going to have to see higher taxes on food. You're going to see taxes on everything because the money has to come from somewhere. The Chinese are going to only lend us so much. The 10-year rate yesterday went up to close to 4%. They're basically saying no more. We don't want any more of your debt. So we have to start being responsible.
Okay, so what do you think is a solution? Because obviously you don't think the plan set forth presently is going to work. It's going to cost us too much?
We need to come to the middle. The problem is one's going to one side, one's going to the other side. We need health care reform. We just don't have it. But most people don't even realize there are great options out there. The unfortunate thing is that stockbrokers and insurance salesmen don't make money on putting these products out there. Quick example, my family of 5, 3 children. My total out-of-pocket cost for health insurance for the year is no more than $9,000. At a minimum, it's $3,000. I have high deductible health insurance with the health savings account where I put the deductible in there, comes off my top line, whereas if I was to do a full boat health insurance policy, it costs me close to $15,000 a year. Wow. So there are options out there, but there's no way it has any incentive to sell it.
As we were talking about before, healthcare is usually people get coverage in case of emergencies, not because they're going to need to get coverage every single month or go to the doctor. It's more for emergencies.
Absolutely. And well, even my policy, which is I still am allowed one well visit a year, so there are options out there.
Okay.